Good morning, good afternoon, good evening, everyone. My name is Dr. Manish Kohli, and I'm truly delighted to present to you today. I currently serve as the Senior Advisor at the Albright Stonebridge Group in Washington, D.C., and I also serve as the Board Member and Global Programs Committee Chair for Wings of Hope. My co-presenter, who regrettably will not be able to join the presentation today, is Brett Heinrich, who is the CEO of Wings of Hope. Today, I will be sharing with you our work on building digital bridges to bring hope and healing to those who are hurting the most. First, a little bit about Wings of Hope. Wings of Hope was founded over 50 years ago when two flying nuns realized that their airplanes, which they had flown into the communities in Africa, could not be flown in the morning because the hyenas had licked the glue, and as a result, the fabric had fallen off the wings of their aircraft. Thus, they put a call out to a couple of philanthropists who donated an aluminum frame aircraft to the nuns. These were the humble beginnings of Wings of Hope. Since our founding, we have served 48 countries and have been honored with 2 Nobel Peace Prize nominations. Our mission is to change and save lives through the power of aviation. And we envision a world in which people have access to resources they need to create a better life. We align our work to the UN Sustainable Development Goals. And we pride ourselves on the 4 core values around which we build all our programs at the Wings of Hope Global Humanitarian Network. The first and foremost is scalability. Any initiative that we undertake, we do it with the mind of being able to repeat it reliably and successfully in other communities throughout the world. We also focus on stewardship, where we can look at measuring the impact of our work, and then being able to go back to our supporting agencies to demonstrate that the support, whether it's monetary or it's in kind, has gone as far as one can take it. We also look at creating sustainable models of care and empowering our communities where we serve. As we work toward building sustainable practices, we focus on strengthening our global humanitarian network partners across the globe in the areas of capacity building, in building knowledge, providing best practices, and really inculcating a culture of data-driven culture of improvement and humanitarianism. We work with the global humanitarian network partners to work with communities in participatory methods, empowering local citizens, providing training, and utilizing local resources where possible. We have partners across the globe, from Colombia to Papua New Guinea to Zambia, Tanzania, and other parts of the world. We partner with service providing organizations, with donors, with volunteers and vendors to really purpose fit aid that's needed to create the maximal impact in communities throughout the world. One of the communities we're working with, our partner in Colombia, Patria Civil Air Patrol, is El Charco, which is located on the Pacific coast of Colombia. This community is geographically isolated and it has a very high poverty rate. In fact, 99% of the residents in El Charco live below the poverty line. And the health indicators in these communities are some of the most pressing in the world. Patria has done an amazing amount of work in these communities, flying into these communities and providing necessary care on an annual basis. They take brigades of 40 to 50 qualified professionals, mobilizing 2 tons of equipment, and set up clinic for 2 to 3 days during each brigade. However, one of the things that Patria has articulated and sought help for is the ability to do more for these communities when the planes are not on the ground. They want to have a mechanism to connect with these communities and continually provide care in a manner that is going to create impact over the long run. And with despite all the tragedy that COVID has created, it opened a lot of possibilities around leveraging modern tools and technologies of telehealth and remote patient monitoring to begin to reach these communities during times of great need, but also to provide continuous engagement and connectivity. We're also looking at building a drone program to provide life-saving medications and supplies when needed, and fundamentally leveraging a data-driven approach so that we can continually monitor and understand what the emerging needs of these communities are and mobilize the appropriate aid for these communities. This is a big lift for an aviation-based humanitarian organization that is trying to create a more sustainable ecosystem. And some of the things that Patria has proactively come and asked Wings of Hope and the Humanitarian Network is support and funding to build this program. Know-how and how do you develop the program, and gaining access to vendors and international domain partners to build this digital runway that we hope will provide a secure and stable mechanism for us to stay in connection with these communities, but provide services through the tele modalities. We are actively in the process of deploying telehealth and diagnostics and a digital clinical record for our pilot, which is due to kick off in early January next year. We are focusing on improving maternal mortality and maternal health indicators in the community as a start. But once the digital runway is built and is functioning in this community, we hope to build other programs for El Charco. But not only that, we also intend to use this framework to scale rapidly to other communities throughout Colombia and then Latin America and beyond. We're also looking at modernizing our airplane fleet and looking at drone technology for use in Latin America, in Africa, and other parts of the world. Of course, predicated on all of this is beginning to look at how we use data from our work to continually improve and the work that we're doing, but also develop new programs and mobilize expertise that is going to continue to meet the needs of tomorrow. We believe this learning, growing ecosystem predicated and built on a digital platform is the future of humanitarianism, augmented and connected by the existing healthcare infrastructure and our aviation-based program, which have so successfully been helping these individuals for over 50 years. So as we look at building, scaling our humanitarian network and deepening and broadening our impact across the world, we want to build around our aviation and volunteerism program, stronger medical and education programs, but creating an envelope of technology that builds a digital front door so anybody living anywhere can engage with our humanitarian work. And we also want to build digital runways that connect us with communities that are the most vulnerable, and then mobilize partners to help us execute on meeting the needs of those communities. This is in the aviation world is a big lift, but we feel confident that the values that we espouse and that the passion that our volunteers bring and the sheer possibility that technology has created is going to enable us to go far, way beyond where a fixed wing airplane has allowed us to get to so far. We do believe in the future is in building on learnings, building on hope, and really creating new paradigms of delivering humanitarian aid. We believe that where there are wings, there is hope, and we want to call out to each one of you. We recognize that there's a large clinical engineering community throughout the world, across many countries, to the tune of 800,000 members. We invite you to reach out to us and join us in helping save and change lives in many communities around the world. Thank you so much, and we look forward to hearing from you and working with you.